All right, so we're going to do a side bend spinal PAILs and rails here. What I like to do with this one, rather than getting that side bend here, we're really going to focus on specific points that are either a little bit painful or points in your spine controlled articular rotation that you're finding it difficult to get. So for me personally, my left QL, which sort of runs down through here, was sore for years, probably because of a ton of arthritis that I've got through that lower back from the car crash. So that was sort of sore and sensitive and would flare up a fair bit, but also when I did my spine cars, I'd come down here, rotate, and then when I get that side bend, that section there, I didn't have as much movement just through that little quadrant, sort of that back left side bit, as much as I did everywhere else. So what we're gonna do, obviously just got a bench here at a pole. So I'm getting into this left side. So what I want to do is I want to get my hip close to the pole here and then just reach over the top. And then I'm going to pull, like with my body, pull out to get into that stretch. But what I'm not doing is I'm not doing this sideways. I'm going to get here and then I'm going to kind of rotate out so that I've got my spine bending right to the point that I actually have problem getting to. So the same as every other PAILs and rails, we're getting to a passive stretch to then actively use that tissue in that passive stretch. So I'm going to rotate around, pull my body sort of out with my hips staying there so I've got that curl in the spine. I'm just going to sit here. And once again, so the PAILs is the progressive side, so this is this side, and then the regressive side is the small side there. And then you're going to hold this for 2 minutes. Now I'm going to do a progressive. The PAILs contraction is me trying to do this, but obviously it's an isometric that way. And then once that is up, I'm either doing it at 10% for like 100%, or sorry, 10 seconds for 100%, or 30 or 40 seconds at a lower intensity. And then I'm going to go the other way using all this regressive tissue. That is the tissue that normally gets sore, so be mindful. I'm now going to try and get a little bit more here. And you're going to keep going, go, 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 have a rest, and then go again. So the trick here is to find exactly that angle that gets that tissue that's a bit sensitive and sore or doesn't work as well as it should. Gonna be mindful here, your nervous system is gonna be very, very quick to think you're hurting yourself. It's gonna be overprotective. Really be careful with loading up the intensities here. Even if the program says 60 to 70%, literally start at 30% and just build up. Be very, very cautious. You're probably only going to be able to do a couple of reps because it does take a fair bit of a whack on the nervous system while you're doing this. But also be mindful that you're going to start cramping. You're going to get cramps. Like if there's tissue here that doesn't work, the same as everything else. Like when you do a hip internal rotation, PAILs and rails, you get cramping here. You're going to get a cramping sensation in there. That's okay. What's not okay is that you get a cramping sensation and then you freak out about it, because then you get worried and your nervous system then gets more worried, and then that causes that cramp to be a problem because everything else seizes up. Remember that this is going to happen. There's a difference between cramping and a little bit of discomfort and a little bit of pain and bad pain, obviously. So take it easy, take it slow, but be mindful you are going to be getting that. That's literally the goal, not from day one, but once you start increasing that intensity, that's going to happen. But most important, get that stretch, find the exact tissue you want, get that progressive side, and then that regressive side, trying to actively get into a bit more of a stretch. Anyway, enjoy.